Bald is beautiful, but it's not for everyone. Hair loss is a serious issue that has left many of my clients very frustrated. Here are a few statistics on how it's affecting women and just how prevalent it is in today's society. Not only is this a medical condition, but like many other illnesses, it comes with larger psychological impacts, and most that men might not face. In 2011, a survey of 2,000 women by Lab 42 showed the following. 66% of women with perceived thinning hair think about their hair loss on a daily basis. 65% of those avoid doing some type of activity, such as swimming or even letting their spouse or partner touch their hair. 39% of women agreed that their hair loss affects their sex life, and 79% said that hair loss makes them less happy than they could be, and actually 9% felt that their hair loss made them depressed. Finally, 55% feel judged based on their hair loss or thinning, with 86% envying women with thick hair. So here are the facts. 40% of hair loss sufferers in the U.S. are women. 40% of women have visible hair loss by age 40. The incidence of hair loss in women increases significantly with age. Unlike hair loss in men, female hair loss is commonly seen at any age and may not have the obvious hereditary association, and also may not occur in a recognizable female pattern alopecia or diffuse thinning over the top of the scalp. So let's start by exploring the hair growth cycle and causes of hair loss. The hair follicle is an anatomical structure which evolved to produce and extrude a hair shaft. Human hair growth is a continuous cyclic pattern of growth and rest, known as the hair growth cycle. On average, we lose 50 to 100 telogen hairs a day. And there are 3 phases of the hair growth cycle. The first is the anagen phase, which is the growth phase of 2 to 8 years. Catagen, which is the degradation, or 2 to 4 weeks long. And finally, telogen, which is the resting phase, and our hair is in about 10% in that phase. The etiology of hair loss includes genetics, hormones, health and diet, stress, prescription drugs, as well as hairstyling products. 99% of all the products that are marketed in the hair loss treatment industry are completely ineffective for the majority of those who use them. But in the modeling world, there's a secret supplement out there, and that's called Viviscal Professional Hair Growth Supplement. It's been developed with a patented marine protein. It includes this deep-sea marine protein, which is the active ingredient called amino mar, as well as biotin, fumed silica, apple extract, and it's recommended to be taken twice a day. Viviscal Professional Supplements work in 4 stages over a 6-month period of time, but we notice that patients are seeing a difference in just 2 to 3 months. The nutrients in amino mar help nourish your hair naturally during the anagen phase. So now let's talk about the trial that was performed by Steve and Associates, and it's actually the largest trial of a drug-free supplement where 96 patients were enrolled in this study. This was a double-blind, placebo-controlled clinical study evaluating the effects of Viviscal oral supplement when used by females with self-perceived thinning hair. It resulted in a 7.4% increase in the diameter of vellus hairs after 6 months, with a 1.6% decrease observed in the placebo group for the same period of time. There was also an 18.3% reduction in hair shedding after 3 months. I recently presented a clinical trial on Viviscal that I published in the Journal of Clinical and Aesthetic Dermatology. My study was on 15 patients, 10 were on the active and 5 on the placebo. And the results of the daily administration of Viviscal significantly increased hair growth after 90 and 180 days. Amazingly, at 3 months, we saw significant improvement, statistically significant, with an increase in hair growth with a mean of 271 to begin with, up to 571 at 90 days, which is more than double the hair growth of terminal hairs, as well as up to 609 at 180 days in the studied area. We did not see any change in the vellus hair, and in patients on placebo, there was no improvement. In addition to the objective measurement of increased hair growth, significantly more women treated with the study supplement reported perceived improvements in overall hair volume, hair shine, as well as thickness and scalp coverage as early as 3 months. We even had twins in the study, one on active and one on placebo, and at the end of the study you could tell which one was on which. And the one that was on the placebo said, "I need to get some of the supplement and look as good as my sister does." We were extremely excited by these results, and in our practice today, our patients love the product. We have very happy patients with before and after pictures that we take for them at the 3 and 6 months, and they just see amazing results. We are very, very excited about this product.